talking about the risks, adversity, and of course we came through here because I've been talking to students, especially first years, about Mjolo and so on. But one of the big things, and I just mentioned it in passing when I talked about Mjolo, is sexually transmitted infections. And sometimes it feels unreal that it's still happening. People think it's just HIV that's going on. People are only worried about pregnancy. I want you to talk to us about sexually transmitted diseases. Does it still happen? Do you see a lot of cases in hospitals? Is this something that, in fact, we should emphasize teaching young people at high school?
Absolutely. I think it is absolutely important when having the conversation around pregnancy that we have the conversation around safe sex. Okay. There is actually a very wide range of sexually transmitted illnesses that there's quite a number of them that affect men and women differently. There's viral causes, there's bacterial causes, and they all manifest differently. Do we see them commonly? Interestingly, we still do. But we don't see the end stage gonorrhea, that one gonorrhea picture that they show to all the students.
The one that they scared us with.
That's scary. I was actually quite scarred from that gonorrhea picture myself. But we do not see a lot of those, but we do see the early stages. And I'm actually quite glad that people are coming early on.
Good.
Yes. It's always a very interesting one, having a consultation, whether it's a male patient or female patient, because it'll be 2 o'clock in the morning and then you find them and you put them in your room, you're like, hi, how can I help you?
In the morning? Why in the morning too?
Because unfortunately sometimes they have to wait to be seen. Yes. And then you're like, hi, how can I help you? And then they say nothing. You're like, okay, so you came here for nothing. It's always a very interesting conversation, especially with the male patients. It's always very
no, but I mean, you are small. Imagine as a male patient.
It's always very interesting.
I must confess in front of you.
And then they will give you this vague story. Oh, I have stomach cramps. And I was like, no, what do you really need?
Yeah.
And then they say, oh, doctor, there's a funny discharge coming from way down there, and then you know.
So which means by the time men go and consult, it's really hectic. Or they don't wait too long, or is it so painful? Or
I think
they have to.
Most of the time it's not about how far along it is.
Okay.
I think it's having discharge come from your genitals that is foul smelling, is constant, it stains your clothes, it is worrying. So a lot of the times, if the symptom is the discharge, they present very early.
Okay.
If the symptoms are a bit vague, say maybe it's a small lesion or it's an ulcer, then maybe they hold on to it and hope that it gets better and then buy baby powder. We do very weird things. But when it's the discharge that's foul smelling, then they present very, very early.
And it's important. Basically, if you're a student out there at varsity, discharge, foul
smelling discharge. For girls,
doctors know.
For girls, there's physiological discharge. The discharge, it's white, it's clear, it doesn't smell bad. It's the discharge you get before your period.
Yes.
But the moment the discharge starts having color, it's a bit yellow, it's a bit green, it doesn't smell so good. The moment the discharge starts looking abnormal, seek help. Let someone else say, no, that's not.
And the important thing is do that as soon as you can. No need to be embarrassed. In fact, doctors see this regularly. And doctors are very happy that you are there in time. Because if you come later, you become a problem. Actually, doctors must solve an old problem.
It does. So, for example, one of the STIs, syphilis.
Yeah.
You have primary syphilis, you have secondary syphilis, and you have tertiary syphilis. So on average, the primary syphilis, it becomes like a small lesion, it's a rash, then secondary syphilis. But when you get to tertiary syphilis, it's when the syphilis has spread to the brain.
Oh, really?
Yes, you have patients, they come in, they are confused, and we are looking for the reason for this confusion, and you do tests and you find that they have syphilis in the brain. It's because it gets into the bloodstream and then it travels all the way up. Whatever's in your blood can ultimately get to your brain, and that can mess with you. Syphilis is one of the few ones that can get to the brain, HIV being the other one, and then start causing start causing problems.
Okay.
And
by that time, the person doesn't connect what's happening, or family brings them.
yes, it's usually.
But they don't
think
connect
it's-
it to.
But also,
STI.
by that time, a lot of the times they had the syphilis infection years ago, and it has remained untreated.
Oh, so basically a patient can go on with syphilis,
Yes,
functioning and having sex and
absolutely, they
No,
can.
really?
Normal.
Basically spreading it.
They look asymptomatic, but they can still spread it. Even as a mom, a lot of the times when we find the syphilis, especially in the female population, it's when they're pregnant. Because what we do a basic HIV, hepatitis, and syphilis test. And a lot of the times for women who are syphilis positive, they've been asymptomatic. They did not know they had syphilis.
wow.
And we test for it because it has detrimental consequences for the child. If the child has syphilis, they can get very, very sick, and the prognosis can be quite poor. So it's one of those important ones that we screen for. And unfortunately, syphilis may not have a discharge. You may not be.
Yes.
So
you
if
see
you,
a
what
rash.
I would say, if you are a young person getting into a new relationship, this may sound boring, but don't take it from me as another young person. Take it from me as a health professional.
Yeah.
Take your boyfriend, and one of your dates must be you go get an HIV test and you get a syphilis test.
Because normally they focus on the HIV.
On the HIV
Not
only. It's
syphilis.
like, what's your status? It's like, no, also check for syphilis.
Yes.
Check for hepatitis B.
Ah.
Yes, very simple.
How does hepatitis manifest itself?
A lot of the times it's blood-borne, and it isn't, unfortunately, unlike syphilis and the other STIs, it's more blood-borne, so you get it via contact. Yes, and that's more important in mother to child transmission for hepatitis.
Okay.
Yes.
Okay.
And how it manifests itself, you just start getting liver problems. It attacks your liver. It's a virus that goes and attacks your liver. Symptoms: your eyes start going yellow.
Before even your liver gets hectic.
But by the time your eyes go yellow, it's a representation that bilirubin is accumulating because your liver is not doing well. And these are things that we can manage. These are things that we can treat, obviously depending on where it is, what stage it is. But on average, these are things that we can
But
manage.
the issue, Rita, that young people need to realize is that this can be as a result of having sex. It's as a result of having sex with one person. It can be. And then you end up with that kind of hectic. Even though the doctors can manage it, I mean,
sure.
what we're saying is having protected self is key. You don't want to be managing this stuff. I mean, adulting is hectic.
Life is rough on its own.
Life is rough on its own without
Life
hepatitis B and
is
syphilis and whatever.
Horribly on its own.
You
I'm
know.
about to cry because life is so rough.
And you have a medical degree plus a salary and it's still
And I'm
hectic.
about to weep. Yeah.
So it's important for young people to know
For
that,
girls
yeah.
specifically, there's what we call PID, which is pelvic inflammatory disease. Yes, PID. There's stages for PID to grade 1, grade 2, grade 3, grade 4.
Yeah.
Simple PID, you get the discharge, maybe even asymptomatic, nothing really. The problem with PID is whatever the cause is causing that, whatever, if it's bacterial, if it's viral, it goes up. So it will be in your vagina, goes up to your uterus, and ultimately can even go up to your ovaries. And in stage 3, grade 3 and grade 4 PID, the bacteria infection ends up forming collections. That's how severe it can be.
And
that's
only,
when it's
you only
untreated.
get it through penetrative sex, or you can get it by sitting on the toilet seat.
On average, it's sexually transmitted. The bacteria that does that, on average, is sexually transmitted illnesses. With regards to sitting on the seat, I'm not really quite sure what the research stands on that, but there hasn't really been much that is focused on that.
Okay.
It's usually the sexually transmitted infections that are well researched. So,
Sure, that's scary. And then what's with the guys? Because we've also been focused on the females, and it's important, people must take care of themselves. But I also hear that the guys can also get lice down there.
Lice. You can get lice any part of the body.
Oh, is it?
It is one of the most shocking things that you can have worms coming out of you.
Can't
It's
say.
shocking.
Doctors see things. Eh?
It's shocking.
You see people having worms out of their bodies.
Worms.
Why? Because there's dirt or because there's an infection?
It's because
or...
the infection, at some point, that infection creates pus, and that's where worms are bred, and they just start to grow out.
Wait, and the privates can have that? Because I thought it's because of their hair.
No.
And then lice can hide there, and then they can just share them with others, whoever they sleep with, even when they have a condom.
It's very when it comes to sexually transmitted diseases, there is so much that can happen,
Yeah.
and unfortunately, human physiology in itself, interestingly, wherever there is infection, there is always going to be an opportunity for worms to step up and to happen. And so it's very, very important that you self-inspect. If
Yeah.
you feel that things feel a bit different, you feel a sore, you feel a lesion, it's a discharge, it's a rash, that's not normal, that's not common, that's not usual, then seek help.
Yeah.
And don't ask your friends.
The sooner,
Because-
don't ask Google also.
Don't ask, they will tell you to use baby powder, just no.
Just
Although the
Google.
vaginal creams, sometimes that helps,
Okay.
but sometimes that's not the problem. So rather just go to a place where you know you will get the adequate help, but most importantly, safe sex. Safe sex, safe sex, safe sex. If you still get an STI after protecting yourself, then unfortunately, it's one of those unfortunate events. But on average, if you take the measures to protect yourself, you will remain healthy.
I think that's a good point to end on. At the end of the day, what matters is safe sex. Of course, it would be great to preach non-indulgence, abstinence. But we know that if we do that, you're not even going to listen.
The reality.
So, safe sex. Bazalani, please, safe sex. Even when you are the bishop, whatever, safe sex.
Not the bishop.
No, you never know. You just take care of yourself. You know what you're doing. Whatever you're doing, you must know that other people may also be doing it. So play it safe.
Absolutely.
We are not here to make you the bishop, but we are here to say be safe. It's for your own good, for your future. For if you're at university, it's even more serious. You go to a party, you tipsy, you know, you forget who you're gonna be sleeping with. Hey guys, please just be safe. Take care of yourself. Safe sex is the way to go. You know, just don't play around with this. But thank you very much, Rita, for talking to us. It's been really useful. I'm sure we'll connect again another time talking about something else. But thanks to you for joining us. Remember to leave your questions in the comments down below, and I'll read them. I'll respond as far as I can. Subscribe, click notifications so that you know what's going on, and tell more people to subscribe. Really appreciate you joining us. Thank you so much. Have a good day. See you another time. Bye bye.